when the valve leaks, it used to be that the only solution would be to replace the valve with an artificial valve. And that is still possible, but artificial valves carry certain disadvantages. If you use a mechanical valve, you need to be on a blood thinner medicine called Coumadin. If you use a tissue valve to replace the leaky valve, then that valve is going to wear out at some point down the road. And for a younger patient, which is generally the type of patient who has a leaky aortic valve, the tissue valve will wear out when they're still young, and they'll be looking at multiple operations down the line. One option to a valve replacement in many patients with leaky aortic valves, with aortic insufficiency, is aortic valve repair. The advantage of aortic valve repair is that it uses your own aortic valve tissue, and therefore it's not going to wear out like a pig valve or cow valve would, and it doesn't require you to be on any sort of special medicine. No blood thinner medicines are necessary. And it's been shown that in most cases, repaired aortic valves are quite durable, and many patients will have a repaired valve last the rest of their life. And if we repair your aortic valve before your heart starts to fail, we would expect that your life expectancy would return to normal and that your heart would continue to function normally.